Every nation depends on the health of its people. To transform Ghana, we have to be healthy. And this is what the government is putting in place to ensure that most vulnerable have access to quality healthcare. The Ministry of Health is working assiduously to introduce comprehensive measures to tackle the fundamental problems of too many Ghanaians dying because they can't get proper health care. In this regard, the Minister of Health has decided to embark on a regional tour to assess the health facilities in the country. Kwaku Agyeman-Manu is the Health Minister.
As part of my work plan, since I joined the ministry, an activity I put down to undertake was to visit and tour as many facilities across the regions of the country as possible. Last year was a very tiring year for me. I need to do a lot of learning and understanding and tracking the health systems, so I couldn't get space to do much tour as I planned. So I could only visit Central Region. At the end of the year, I said to myself, 2018, I want to make sure that I tour all the regions and visit as many facilities that I can visit as a way of gathering information, still on my learning course, and seeing things practically hands-on for myself, because I don't think it's very adequate for me as a health minister to sit only in the office to take reports and information coming from the field. I also needed to interact with health workers who are sitting in various facilities and a lower level sub-district facilities as well. And that is how I came to Northern Region.
Several hospitals in the Northern Region are under serious condition and are finding it very difficult to accommodate the large number of people who visit the facilities to access proper health care. The minister on his tour to the Northern Region paid a courtesy call on the Northern Regional Minister, where he received briefing from the regional minister.
Your coming is really appropriate and timely, given the fact that we are just taking off and His Excellency, the President, all his flagship policies initiative. This is the year that we are declaring as the action year, and therefore we need to know how we are moving, and health is key. Northern Region, we have huge potentials but also a lot of challenges in the health sector. But first of all, on behalf of the people of Northern Region, we want to first of all thank you and celebrate you for taking the bold initiative to work very hard to clear the huge debts that sort of cripple the effective functioning of the health insurance.
At the Regional Health Directorate, the Health Minister and his entourage met with some health workers and interacted with them.
There are certain facilities that people don't want to go to. Now, like, why? The hospital had the this is for this particular hospital, I won't go there. So you travel to go somewhere else. That's why the president doesn't come in. The regional minister is not there. The minister is not his problem. But those of you work, it's an indictment on you. If patients say that, as for this particular hospital, we won't go there. And it is real, not only in the Northern Region, across the country. In some facilities, you can find 1 or 2 doctors. The community people will say, for this particular doctor, we will go. Why? Quality of care is compromised.
We know government is making a lot of efforts when it comes to nurses and other technical staff. But we want to appeal that as and when resources permit, let's look at this area. Because you go to some facilities, you have the enrolled nurse or the staff nurse who is the only person managing the facility, doubling up as the storekeeper and virtually all other functions. We have our health commodities, pharmaceuticals, that are being managed by people who are not professionals, and this is money we are putting in there.
But let's be very frank with ourselves. Most of the casuals we know in the system are people's relatives, friends, and some don't even have any qualifications. So really, I don't think it can be a blanket or approach. Some have no qualifications, no BC, nothing. And they are just there doing X and Y jobs. So there will have to be some level of individual investigation and certification before really some payments can be done and agreed upon. So I just wanted to make this point very clear.
No, I wrote a letter initially that you should also make lists of casuals on your IGF payroll. Initially, with my background, that was against the rules. You can't employ with IGF. But across the country, when we got statistics and we added on, close to about 58 or 67,000 sitting on, in hospitals as IGF employees, and the amounts that are being paid to them, it's nothing to write about, because IGFs are not adequate. You need people to work, you hire them, and so you negotiate for some paltry services. Some have been there for years, and then I said this can't continue. Something happened when you wrote the letter. I wrote the letter and solicited for information. I quickly wrote back that nobody should employ again, because we're breaking all rules with labor. You can't employ somebody casual for how long? And therefore we tried to work on it.
The minister talked passionately about deficiency within the health sector. He lamented bitterly on how certain drugs that must be given to patients free of charge, on the contrary, are sold to them as IGF. He stressed that hence government will not condone such practices. The minister proceeded to the Tamale Teaching Hospital to familiarize himself with the facilities and projects underway. He, however, met with some health workers and interacted with them.
The challenges that the CEO started pouring out, I was sitting down there and asking myself, does the CEO think that I don't know about all these challenges? I think I know them, and I believe that it's only re-echoing for us to speed up our preparations to see how quickly we can get around to solve some of the challenges. But let me thank him and your directors for the little turnaround things that you have done in this place, the facility. Now the oxygen issues aren't coming to the ministry quite often. We thank you for that. The sterile packs and things that you need to look at what it is that you are doing here. And you put disposal of expired drugs as part of the things you've managed to do. Why should we sit here for drugs to get expired? That is a question. Why should we sit here for drugs to get expired? Not only here in Tamale Teaching Hospital, but across the country. There are some of our donor partners who give us medication, especially into malaria. They will put them on our shelves and they go expired, and they will go and spend money to dispose of them. This is just not acceptable. What is causing that? Either we are not doing our calculations well, because as we sit here, we don't even know how much money we consume in terms of malaria medication in a year across the country. I've asked for this for the past 1.5 weeks. I'm not getting a hand on a particular figure. So we are not computing and doing our statistics and our estimations and calculations very well. So no wonder we are throwing drugs away. Some part of it from investigations and things that I'm reading, reports, deliberate conscious human action to get them expired. We wouldn't use them. USAID buys us medication. Global Fund gives us medication. We keep them on shelves, and some of us are still buying from outside. And so when we prescribe, we sell that we have bought and leave the ones that are supposed to facilitate us for free. And then we turn around and say health insurance owes us. Why shouldn't they owe you? If you have free medication you wouldn't use and you are billing them, me, I won't pay. Yes. But But you see, you and me are Ghanaians. And for the sustainability of health insurance, this type of thing shouldn't happen. You have it for free, you debit health insurance to come and pay, and then you go and throw this one away. It doesn't make a lot of reason. But we're investigating and finding out why these things are happening. I believe with time, we might have to find some way to change some of these things.
I can assure you that the Minister of Health of the day is poised at turning things around. All we need from all of us as a people is to continue to look at things in a very positive direction. That how can we put ourselves together to be able to confront the challenges that has bedeviled the teaching hospital for some time now. So your role is important, my role is important, and the role of the minister is important because everything is about synergy.
The minister met with the students of Tamale Nurses Training College and advised students to take their studies very seriously.
So you have to listen to your lecturers, pay attention, devote so much time to learning. As for your exams, I think nursing exams is not very difficult. Oh yes. Let me tell you our history. You know why I say it's not difficult? When we were in school, those days we were doing the O levels and the advanced level. The O level one, those who passed very well, will go and do 6 form towards university. Those who couldn't filter through to 6 form, they were going to do nursing and teaching education.
That if you don't know, it is the prevention of pregnancy and helping the infertile couple to achieve pregnancy.
We have close to about 90 health training institutions scattered across the country, almost every district. Not almost every district, but every region has a number of these health training institutions. Last year, the new government, as part of its manifesto pledge, reintroduced allowances that the previous government had actually stopped paying to these young people who are getting trained to provide health care for our people. Fortunately or unfortunately, we couldn't do 12 months the entire year. Government policy, we have to do 10 months for the nurses. Why? Because when students are on holidays, it's like we wouldn't need to facilitate them with government resources for nothing. So when cabinet sat and government was introducing this allowance together with the teacher trainee allowances, we all drew attention to ourselves that to cut down resources going to that area so that we can invest somewhere else, we needed to make some savings. So we agreed that we wouldn't pay trainees whilst they are on holidays. So teacher trainees were going to get 8 months, and then for the nurse trainees, we said because they go on attachment to do clinicals during holidays, they need in some instances to buy certain materials to actually train with on attachment, things like gloves and cotton wool and certain needles and syringes. So we said we'll give them 10 months, and I think that is how come teachers are getting 8 months for the year, whilst the nurse trainees will receive 10 months.
The minister and his entourage traveled to Bumpurugu, where he received a warm reception from the district chief executive. He later met with the health workers and interacted with them.
I want to congratulate you for accepting me to serve in the district. That is one of the far away to reach, difficult to reach areas. And I think I might commend you for that decision you made in your lives to support people in this part of the country. You could have left to go somewhere else. Almost everybody who trains to be a nurse wants to go to college or Tamale Teaching Hospital or Kumanochi and things like that. But you have decided to come and serve as here. I think you need a lot of commendation.
It appears there's no existence of board of governance for district health services in the area, and hence monitoring and checking through whatever is going on becomes a problem for us.
Like I said earlier, the district director has given me
almost everything that you have said here. Go to buy the staffing situation, everything. What we're talking about, the functionality of the chip compounds, they are all here. Some of them are left with toilets and things like that. We are working on them. The expansion, district hospital, we have a policy that will push us to do a district hospital for each district. You know, and we are starting some of these things now. Dr. Baumia is actually leading that crusade. So we will see how best. We'll probably look at Bumpuru.
To go to Naswan Service 3, it might not be like Bumpuru here where you can get probably a house to rent as a staff. The house is there probably, unless you get accommodation from what the city has built, just a few. So the staff who are posted there, we are faced with a lot of challenging issues. We are just sacrificing. Some are sleeping, sometimes you sleep with reptiles and other things. You get up and you don't even know where to put your head. So I appeal to you if you could at least visit that place and address our challenges, our accommodation challenges for us.
During the tour, we also realized that workers in the rural areas have challenges with accommodation. Not only accommodation, there are certain other things that impede their progress in even delivering service. Things like ambulances. They have distances are wide apart from where they are, especially the chip compounds, to their referral centers, the higher facilities in the districts like district hospitals or even polyclinics and health centers away from chip compounds. Roads in the part of northern region that we visited are not very, well done yet, and distances are wide apart with no ambulances, you know, and accommodation, like I said, in some instances, even when you have money to rent, the facility is just not there. You can't find a landlord or a landlady to give money to get a place for. And then at that instance, in fact, I was compelled to actually donate 2 motor bicycle, they call motor king or whatever, because the health worker spoke passionately at a meeting. They were doing their district review at Bumpuru when I met with them. And from their engagement and interaction, you know, we just couldn't run away, me and the Deputy Minister for the Northern Region.
The minister and his team paid a courtesy call on the Bumpuru Naba. At Bindi Hospital, the minister and his team inspected a few facilities and interacted with the patients. The minister paid a courtesy call on the Bindi Naba. At East Mambrose Municipality, the minister and his entourage moved to the Baptist Medical Center, interacted with some health workers, and toured the facility.
I came learning, I came gathering information, I came facing challenges, and I want to encounter some of the difficulties that we have hands-on, so that physically I can bear witness to some of the problems that come into your ministry for us to look at. Then my engagement with you is an interactive session, such that I can listen to those of you middle and lower level health professionals, the type of difficulties you go through, and how best to think of your facility, and what things we think we can bring here, more ideas to help us, guide us into policy, and see how best we can strengthen health systems in our country. We need to do so much, but it looks like all that we do, our outcomes are not very satisfactory, especially with issues that have been put into what they call the SDGs, right? Maternal and infant child issues. We don't think that we are doing the best in our country. So my presence here is to motivate and encourage you all. Let us make sure that our outcomes for certain disease burdens that we have signed engagements with, even with our donor partners, like TB, HIV, and things like that, our outcomes are not getting better. So I decided to come. You talk to me, I talk to you, and then when I go back,
I will know what to do.
Over 90% of our clients are NHIS patients, and we are far behind with reimbursements. So we're trying to appeal to you to help us reimburse us in that regard.
We work on them. We are doing a lot on in these areas, and these are specific challenges. We will see how best we can facilitate your facility.
The health minister paid a courtesy call on the overlord of Mamprugu.
And I just can't come to Northern Region on a working tour, especially coming to East Mamprugu, without coming to pay homage.
The minister therefore visited the College of Health in Nalerigu and interacted with the students.
If you have BMC sitting here and you send 50 of your students to BMC alone for clinicals, what quality of teaching and learning shall we have during their clinicals? So we have to look at certain numbers. Now we made a policy not to continue to introduce new schools. We have close to 85 accredited, and about 10 unaccredited that we are grappling with. We are looking at shifting people from doing certain courses to other areas based on health sector needs. That is where we are going now. So we might not be doing more NAC, right, as opposed to community health. We might not do more NAP without topping them up to be able to do very limited clinical primary care, just like that. So we are adjusting fields. But the policy now is that we are not adding on to close to the 95 schools that we have.
The Northern Region has almost 26 districts, with only 139 community psychiatric nurses, taking in charge of almost 26,000 communities. Please, we are only pleading if the ministry can do something to at least establish some minor psychiatric hospital within the Northern Region, at least to cater for the Northern Region, Upper East and Upper West. We'll be much grateful.
Now, it's been a policy, not very long ago, quite recently, that we should decentralize psychiatric care across the country. So we mandated Ghana Health Service institutions to create wards for psychiatric care in all district hospitals, at least a 10-bed area to take care of psychiatric patients and things like that. But you see, hitherto, we centralized psychiatric nursing in Accra, and Accra had two places, Cape Coast, and I think where again, Kumasi or something. So Ankafo is Cape Coast. You are now spreading out. And when you start doing that sort of thing, it will mean that you may fall short of resources. But we have taken cognizance of this challenge, and we are working towards that.
The minister is poised to introduce comprehensive measures to tackle the fundamental problems of too many Ghanaians dying because they cannot get proper health care.
What I saw at the ambulance center in Tamale is something that I cannot describe. I was a bit shocked to have seen what we call a regional ambulance station, or even if it's the Tamale city alone, the ambulance station doesn't fit what we should call ambulance station. Very old, virtually dilapidated sort of building, part of the barracks. Very old building, some part of it are caved in. And we have virtually no tables and nothing like an ambulance. I wouldn't even mention a computer. I mean, very basic things were just not there. And around them, not a single ambulance that was functioning that would be called an ambulance. And their control room, I just don't know what to describe it. I can't describe it. The building wasn't just good. And that is one of the benefits of the tour that I embarked upon. I think I have had a useful lesson. The benefit of this tour was to see and pick what is practically on the ground. And what I saw in Tamale speaks for itself. This will inform the ministry's proposals for budgeting for 2019. And we're going to look for resources from the national base, not only to restock our rolling stocks in terms of vehicles for the ambulances, But look at how we can fit the stations for the comfort and good working environment for the men and women who have enrolled on to work in these ambulance stations for us.
The regional tour of the health minister continues.